Are we live? Very good. Good afternoon, everyone. This is a joint budget hearing of the House Appropriations Committee and the Senate Budget and Tax Committee. We're going to have initial briefing about the supplemental budget, but the overall hearing is really about the Department of Budget and Management personnel. So I will start by jumping in with Mr. Romans from the supplemental, but I'll ask if Delegate McIntosh, Chairwoman McIntosh, would like to make any comments.
No, it's just always good to be with the Senate. We're very pleased to see this supplemental come down from the governor. It represents a lot of hard work that our two committees jointly did together over the last few weeks. So thank you, everybody. Let's have Mr. Romans come on up.
Thank you. Let me go ahead and share my screen here. All right, you should be seeing the supplemental budget document.
Yes.
Oh, okay, great. So this should just take a minute. The governor submitted a supplemental budget around the time that the Relief Act was passed. We've organized it here by sort of the fund sources. So there were two general fund items in the supplemental that combined for about $10 million. About $9 million of it is for local health departments that had losses with their self-supported fee-for-service clinics during the pandemic as there was less utilization of care. So it's trying to provide some financial assistance to local health departments to offset the revenue loss. And then the Maryland Housing Counseling Fund gets about 1.1 million, mainly to pay their Office of Administrative Hearings expenses, as there's been more activity, again, related to the pandemic. So those are the general fund items. Then the next chunk of items is $150 million from the Blueprint Fund, all for K-12 education initiatives. The first three items on the list are for fiscal 21. The remainder are for fiscal 22. Many of them are continuing programs over the 2 years. There's about $25 million for summer school programs to address learning loss in this current fiscal year. There's about $10 million for trauma and behavioral health support for students who are impacted by the pandemic. And then $10 million to help the school systems get moving with reopening the schools. And then for fiscal 22, there's also $45 million to sort of expand the concentration of poverty grants. Last year you gave, or last couple of years, you've been giving money for some staff in the schools that have the highest levels of concentrations of poverty. This sort of moves into the next phase, giving those schools some per pupil aid if they're above 80% of the concentration of poverty. So it's sort of moving forward with the Kerwin plan. Then you have summer school money again for fiscal 22 for those students who are continuing to suffer from learning loss, more trauma and behavioral health support, and additional transitional supplemental instruction, which is tutoring and other supports for students. As you know, the governor put over $150 million in the fiscal 22 budget for this purpose, and this just adds a little bit more to that. So altogether, about $150 million of Blueprint funds over the 2 years. And then the next large grouping is various December federal stimulus money, and it adds up to nearly $1 billion. It's worth noting there's still more than $1 billion in additional federal money from the December stimulus that needs to come into the budget at some point. What you don't see here that you should see at some point is all the money coming for the health department related to vaccines and testing and contact tracing and the like. There's a couple $100 million of housing support for renters that needs to come in once there's a plan for how it's going to be used, as well as some money for state highways and transit that has not come in. And presumably much of the delay is that they're still working through plans about how to spend the money before they bring it into the budget. But what is in here, the first four items are all in the Department of Human Services. The first three relate to sort of foster care programming. A lot of it is targeting older kids who are transitioning to independence and in some cases are being allowed to stay in the program a little longer due to the pandemic. Then there's almost $6 million for emergency food assistance, which is on top of the $10 million of state funds in the Relief Act. And the rest of the items are for the State Department of Education. The first 4 or 5, I guess, starting with innovative approaches to connecting with students, are from a pot of money that the feds provided to the governor that is discretionary money that he can allocate largely how he wants to respond to the pandemic. So 10 million is going to go for grants to school systems with innovative approaches to connecting with students, 7.4 million to community colleges for workforce development programs, 2.6 million to the independent colleges. These are the Sellinger schools. They get an equal amount. Each school gets the same share of that. It's a couple $100,000. The school for the deaf and the school for the blind getting a little bit of help to with covering their pandemic costs. So those were discretionary decisions for the governor. Then there's about $36 million for private school reopening grants. This money is reserved in the federal law for that purpose. So it can't be used for anything but private schools. It's not supposed to be used for scholarships or anything like that. It's for pandemic related costs, helping them respond with PPE and other things they need to do to continue their operations. The governor has not announced a specific allocation by school, just that there is this program and that the money will be allocated. The largest chunk of money, $782 million, is going to go to the school systems as required under federal law, and it's allocated based on Title I enrollments, which is also a federal requirement. So this brings all that money in. The governor is saying it's for reopening. The actual federal law provides a fairly broad range of things related to getting schools going and responding to learning loss and so forth. The last three items are all childcare related, adding up to well over $100 million. The first is to continue to pay 100% of the cost for the essential personnel childcare program, where the state provided all of the costs for those people who had to get back to work in person. Then licensed childcare program recovery efforts. So these are grants that the childcare providers can apply for through the State Department of Education. And then some money in fiscal 22 to enhance the childcare scholarship program to help, which is a program that provides subsidized childcare for lower income families. So that's the December federal stimulus money. The last little pieces here are two fiscal 21 items. The big one, 434 million, is for pandemic the EBT program. So this is essentially what this is for kids who are not able to go to school and get the school meals that they would normally require or receive. The SNAP program has been enhanced to provide an extra benefit to those families so that they can make sure to provide the children with the food that they would normally get through the schools. So it's about 434 million, which is just the fiscal 21 costs, and will support school kids from all around the state, all the different school systems. The final item is energy assistance money related to the CARES Act. It provided additional low-income heating and energy assistance program dollars. These go through DHS, which already has significant programs, subsidies to people who need help paying that bill. So that is the total of the supplemental. You can see it's a small amount of state dollars, 10 million of general funds, 150 million of special funds, but over 1.4 billion of federal dollars. And as I said, you're going to see a significant amount more of federal dollars coming, presumably in a future supplemental. Happy to take any questions.
Okay, I see Senator Rosapap has a question.
Thank you, Mr. Chairman. Actually, I've got two, I think pretty brief for David. One is, what is the distribution of the public school money, other than you mentioned the big one, the 781 million is based on Title I? What about the ones up in the state, in the MSD stuff at the top?
Yeah, I mean, the 10 million for innovative approaches, I think is going to be sort of a competitive program. We haven't seen an allocation of that.
I think that's right. Yeah. How about the others?
The community colleges, there's a base amount, I believe, of a couple 100,000 that goes to each school, and then the rest is allocated based on unemployment rates in the service area of that community college.
And how about the school reopening grants and the trauma and health, summer school, and all that stuff?
So I don't think we have a specific allocation yet of how all of that blueprint money The concentration of poverty will go out based on that formula.
Okay. If we could get that on all these when you get it, obviously it'd be helpful.
Right, you all may want to add language, you specifying how you want to allocate it. Since it's in the supplemental, you still have an opportunity to specify how the reopening grants should be allocated in the summer school programs and so forth.
You read my mind. Thank you. Second question is there any of the federal money or any of the state money in the governor's proposal that uses the words reopening that actually restricts or gives the governor the power to not give locals money they would otherwise be entitled to because they make a decision not to bring as many kids back as the governor would like?
There's no language that would limit it in that way. I would say the one kind of question mark, and there's been some conversations with the AG's office about this, is that 781 million being limited to reopening in the language in the supplemental seems to limit it a lot more than federal law limited the funds. And that may be an issue when we are investigating that further.
Great. Thank you very much. Thank you, Mr. Chairman.
Thank you. And also on that disparity grant, we have, I think, a bill coming forward that will have corrective issues and items in it for the blueprint. Actually, the concentration of poverty, I'm sorry. The concentrations of poverty is for next year. We will, next fiscal year, so we'll be able to allocate those in that as well. We've got Delegate Proctor has a question.
Thank you, Madam Chair. I'm looking at the meals program, EBT. Have all of our students, I think, at this point that are on the program, they're being delivered their breakfast and lunch, whatever they're eligible for. I think sometimes our buses carry it. When school reopens and children or parents have options, I'm wondering if there's any plan for those children who decide to stay home. Are we still going to be taking them lunch, or are we giving them monies to cover the meals? How do we know how we're going to do that yet?
Let me follow up on that. That's a good question. I do not know the answer.
Yeah.
Okay, Senator Eckert.
Thank you very much. Thank you, David. Up on the at top of the page, and I'm sorry, there was something up there. Oh, tell me what self-supported local health department clinics, I mean, what does the self-supported mean? Most of our health departments are doing outreach programs. So
as I understand it, there are some local health departments that operate fee-for-service clinic type services, and they saw a significant reduction in utilization, at least in the early part of the pandemic. And thus they had, they already had the staff and so forth there. So they suffered some financial losses because of the decreased utilization.
So they'd be our behavioral health or addiction programs, possibly?
Yeah, I mean, it's whatever mixture of programs each different county operates.
Okay, thanks so much. I'm sorry, I missed that in the beginning. Thank you. Thank you, Mr. Chair, Madam Chair.
You're welcome. And we have Delegate Solomon with a question.
Thank you, Madam Chair. David, just had a quick question. I noticed on the education funding from the federal government, there's nothing for higher ed other than the independent colleges and community colleges. Do you have any sense of if the administration is trying to do something a little bit more creative on some of the public school funding? I know a lot of that is supposed to go out by formula as well, or do you have any sense or updates?
I mean, there was significant federal money in the December stimulus for higher ed, and it is all allocated in federal law by institutions. So there isn't really any decision-making for the state on that higher ed money. Really, the only decision-making the governor had is that 20 million or so of discretionary money. And as you saw, he provided some to the privates and some to the community colleges.
So that they'll just have to at least release it at some point?
I mean, a lot of that federal higher ed money actually flows directly to the schools. Now, the public institutions will bring it in as unrestricted funds or restricted funds and so forth through budget amendments, but they'll get the money directly.
Okay, thank you.
Okay, I don't see any more questions. Last call on that. Thank you very much, Ms. Romans. We're going to move on to the Department of Budget and Management Personnel budget. Jason Kramer, our analyst, is going to give us the lowdown.
Thank you, Mr. Chairman. Let me share my screen with you and I'll jump right into the analysis. Hopefully you're seeing the first page right now. My name is Jason Kramer and I'll be presenting the analysis for the Department of Budget and Management Office of Personnel Services and Benefits. I'll discuss statewide salary actions, funding for statewide COVID relief efforts, the impact of the COVID pandemic on the state workforce, and the state health insurance account. This exhibit on page 1 here shows the fiscal 2020 through 22 spending by fund. Most of the spending in fiscal 21 and 22 shown here is either in the statewide program or is for COVID assistance and will be transferred by amendment to the various state agencies. So with that, I will jump right into fiscal 2021 COVID relief funding that's provided in this portion of the allowance. The fiscal 2021 working appropriation reflects $300 million for COVID relief efforts. The budget includes a $200 million general fund deficiency appropriation that is for mostly unspecified COVID relief purposes. One potential use is for response pay for employees working in quarantine areas. However, as Dave has already gone over, there's significant federal funding that's not yet reflected in the fiscal 21 working appropriation. For example, a FEMA rule change now allows for a 100% rather than 75% cost share for certain emergency measures. This would likely result in about $180 million in additional relief funding that would backfill general funds. MEMA has also announced there's about $340 million in additional disaster relief funding on the way. And Congress is currently working on legislation that would likely provide significant aid to state and local governments. For these reasons, DLS is recommending deleting the $200 million general fund deficiency appropriation. DLS is also recommending committee narrative that would request quarterly reports on the state's allocation and use of disaster relief funds from FEMA. There's also reflected in the fiscal 2021 working appropriation is $100 million in special funds from the Emergency Rapid Relief Fund that has actually already been distributed by amendment to Commerce, DHCD, and TEDCO, which those separate analyses discuss the uses for those funds. One final fiscal 2021 action I'll note is that the BRFA includes a provision to transfer $30 million from the unemployment insurance fund to the general fund. I'll next move to Exhibit 3 and discuss the fiscal 22 allowance. Exhibit 3 shows the breakdown in spending in the statewide program and the Office of Personnel Services. 85% of the allowance goes to statewide salary actions. It's about $171 million. Outside of that, most funding is for the Employee Benefits Division, other administrative functions in the department. I'll turn next to Exhibit 4, which will break down these statewide salary actions. Exhibit 4 shows all of the components of the statewide expenses program. The largest is $107 million for the annualization of the 2% COLA that state employees received in January of this year. Of this amount, about $305,000 that's intended for the St. Mary's College portion of that COLA is already budgeted in the campus budget. So DLS is recommending deleting that amount from the allowance. The next largest portion of the statewide program is $30.5 million to implement chapters 572 and 576 of 2020. Those were two pieces of legislation you passed last session. Chapter 572 requires salary increases for certain security staff at state hospitals, and Chapter 576 requires salary increases for certain patient care staff at primarily at Clifton T. Perkins Hospital, although other hospitals would qualify depending on the amount of forensic admissions. There's $17 million for a 4% Sleola salary increase and merit increase effective July of this year. There's also $8 million for recruitment and retention bonuses for correctional officers. I will skip one. And go to the final one. There's $2.25 million in special funds for electric vehicle funding for the state vehicle fleet. And then the annual salary review includes about $8 million for the annual salary review. And that is shown in Exhibit 5. Almost the entirety of this amount is for fiscal series employees. That includes workers like accountants, revenue examiners, and auditors. And that's in response to agency concerns about recruiting and retaining employees for those positions. This amount also includes a very small amount for raising the minimum pay rate to $15 an hour for workers in the state personnel system and MDOT. Just to clarify a question that came up in the fiscal briefing earlier this year, while it does apply to state employees in the state personnel system, it doesn't necessarily apply to employees that are not in the system, which would include things like higher education or non-budgeted agencies. Also, DBM has indicated that it has miscalculated how much this would cost and how many employees it would affect, and has noted that it would be bringing additional funding to cover all the expenses related to this in a supplemental budget this session. Moving to Exhibit 6, this exhibit compares the fiscal 2021 working appropriation to fiscal 22 allowance. I've already gone over most of the major actions taken in this budget. One thing I haven't noted is that there's nearly $3 million in fiscal 2021 excess funding for statewide salary expenses. And so DLS is recommending a provision in the BRFA that would revert the $1.8 million of that's in general funds to the general fund. I will next jump to personnel data. DBM has 133, the Office of Personnel Services has 133.6 regular positions. As part of cost-cutting measures, the office eliminated 1.8 long-term vacancies in OPSB. I'll now move on to the first of 4 issues that I'll discuss with this analysis. The COVID pandemic obviously has dramatically altered state employee jobs, and I'll briefly discuss 4 ways that there's been a significant impact. The first here is in Exhibit 7, the number of cases and deaths in state congregate facilities. There have been 6 deaths among employees at these facilities and more than 3,300 cases, and that's all through the end of January of this year. Outside of congregate facilities, there's not a statewide tracking system or statewide tracking policy for cases or for fatalities, although many agencies do track cases on their own. For example, MDOT has seen about 770 cases through January, with 3 deaths at the Maryland Transportation Authority and 1 death at MVA facility. Other agencies such as state police and DHS have also seen large numbers of cases, but for those agencies and for all agencies, it's not always possible to be sure of where transmission happened, and it's also reporting greatly on self-reporting by employees, so the data is not necessarily always accurate. The next item I'll discuss is increased salary related to the pandemic. In Exhibit 8, the state increased pay for certain employees for different portions of the pandemic. In the early days, for about 2 weeks, employees who were required to come into work received double their pay rate. Like I said, this lasted a little bit less than 2 weeks and was in total cost nearly $40 million. There were 2 other levels of pay increases. Level 1 response pay. This was $3.13 an hour for those who were unable to adequately social distance at work. That cost more than $21 million and was discontinued last September 8th. Level 2 response pay is $5.13 per hour for those who are working in COVID quarantine areas. That has cost the state about $42 million, and that policy continues. Moving on to Exhibit 9, somewhat related to all this is the dramatic shift to teleworking, as shown here in Exhibit 9. The state eased requirements around teleworking, such as allowing employees to have children at home and allowing for more flexible work hours. This data here refers to the number of employees who are considered teleworkers, which means working more than 50% of hours remotely. On the left is July 2019 and January 2020 for a 1-week period. And on the right is July 2020 and January 21 for comparable 1-week periods. This likely undercounts the number of teleworkers pre-pandemic, as like I said, it's not counting those people who work 1 or 2 days remotely, and it also relied on self-reporting by the employee in the state's Workday personnel system. Finally, for this topic, workers' compensation costs have reduced dramatically due to the pandemic. Exhibit 10 shows the large drop in state employees' first reports of injury. There was a stark drop, as you can see, in March and April of 2020, followed by somewhat of a rebound, but still much lower than prior levels. Calendar 2020 reports were about 28% lower than the prior year. Exhibit 11, workers' comp. So how does that translate to expenses? Exhibit 11 shows that. It's estimated that fiscal 2021 payments will be more than $10 million less than the prior year. In recognition of this, DBM has decreased the funding in the budget for state agencies by about $18 million in the fiscal 2022 allowance. Even with that, DLS is estimating an $11 million closing balance for the workers' compensation fund. DBM every year provides guidance to IWIF, the Injured Workers Insurance Fund, regarding the amount of money out of that fund that it can use to pay for settlements of claims. So in other words, paying one fee or one amount rather than ongoing payments in hopes of reducing long-term costs. The average settlement amount provided to IWIF by DBM is about $5 million per year, although there's a lot of variance. In light of the projected surplus, DLS is recommending language that requires DBM to authorize up to $15 million in fiscal 2022 for settlements and to deposit any surplus balance into a fund for unfunded workers' compensation liabilities. On Exhibit 12, I'll move on to the second issue. The second issue is the status of the employee and retiree health insurance account. The summary shows income and expenditures. And as you can see, fiscal 2020 closed with about a $71 million reserve balance. Fiscal 2022 is projected to close with a $25 million reserve deficit, but a positive cash balance. Payments for health expenses grew by 1.2% in fiscal 2020, but that's slower growth than in recent years. And Exhibit 13 will sort of get at why that is. Exhibit 13 shows the invoices to the health and dental plan from the first quarter of fiscal 20 through the first quarter of fiscal 21. And that's broken down by the different types of service. And as you can see, the fourth quarter of fiscal 20 saw a dramatic decrease in the amount of invoices to the state health plan. Outpatient services were down 31% in the fourth quarter. Inpatient professional services were down by 24%, and dental costs, which are a small share of spending, were down by more than 54% in that quarter. DLS is recommending annual committee narrative for reports on the health plan account and data on medical, dental, and pharmacy spending. I'll now go to the third issue, which is a reverse auction legislation passed last session regarding the pharmacy benefits manager. Chapter 434 of 2020 requires DBM to use a reverse auction to select the pharmacy benefits manager and to procure a technology platform to evaluate potential PBMs or pharmacy benefit managers. Exhibit 15 shows pharmacy costs and rebates in the state health plan. This calendar 17 was the last year under Express Scripts. Starting in fiscal 2018, CVS Caremark became the state's pharmacy benefits manager. Cost declined by about 14% in calendar 2018, primarily due to savings in ingredient costs. Costs further declined in calendar 19 and 20. That was driven by large increases in rebates, which are negotiated by CVS. The state's current contract with CVS runs through 2022. DBM states that it's moving forward on implementation of the legislation, but is taking longer than expected because the technology platform will be the first of its kind for state procurement. The state is using New Jersey as a model. That New Jersey has a similar, but not quite the same platform. The delay in the transfer of retirees to the Medicare prescription drug program is also slowing the progress of this legislation. As DBM is required to is having to write two sets of requirements for the RFP, one with retiree coverage by the state and one without. DLS is recommending committee narrative requesting a report on the progress towards procurement of the technology platform and the implementation of the reverse auction process. Fourth issue I'll discuss is conditional raises for some state employees. AFT and MPEC, two bargaining units for state employees, have come to agreements for calendar 2022 that include a $500 bonus on January 1st of 2022 if fiscal 2021 revenues are $75 million higher than the Board of Estimates projections. They have also agreed to a 1% COLA in April of 2022 if those revenues exceed the estimate by $200 million. DBM will apply those actions to members of those two units and also to non-union and excluded employees. These actions would not include AFSCME employees, which remains the only unit of state employees not to come to an agreement with the state for 2022. The fifth and final issue that I will discuss is the Smart Work program. This is a program that provides student loan reimbursement to state employees in certain classes of jobs that are seeing high vacancy rates. Exhibit 16 shows the participation in this program in fiscal 20 and 21. Only about 700 applications have been approved at a cost of about $560,000 to the state so far. There's $900,000 in the fiscal 21 working appropriation and $2 million in the fiscal 22 allowance. DLS recommends deleting the $2 million for fiscal 22 for this purpose, as the need is projected to be lower than that, and state agencies will be able to absorb the actual costs within their personnel budgets. Finally, real quick, I'll just zip through our recommendations. Items 1 through 3 are annual committee narrative, requesting information on the state health plan. Item 4 is requesting a report on the reverse auction implementation. Item 5 asks for quarterly reporting on disaster relief efforts. Item 6 would delete some double budgeted funds. Item 7 would delete funds for Smart Work. Item 8 would delete the $200 million deficiency appropriation. Items 9 and 10 are annual language. Item 11 is language regarding workers' compensation settlements. Items 12 through 14 are annual language. And finally, we're recommending a BRFA provision to revert $1.8 million in excess funding. With that, I'd be happy to take any questions.
Thank you very much. Questions from any of the committee members? I do not see any.
Mr. Chairman, Delegate Young.
Hello?
Delegate Young.
Oh.
Thank you, Mr. Chairman. Thank you, Madam Chair. Jason, I wanted to make sure I understood earlier when you were giving the numbers of state employees that were infected, or number of cases and number of deaths. Did I understand you right? So that's just what we know because it's an accurate number, because those agents can accurately track cases and deaths. Is that accurate?
We know that these are accurate for congregate facilities. We also know that this is accurate for MDOT, 3 deaths at the Transportation Authority and 1 of an MVA employee. We have done surveys over the last few months and we don't know of any other deaths that have happened of state employees due to on-the-job exposure, but we don't have actual accurate information on that because there's not really a statewide collection of that information.
Understood. And I guess the closest attempt to trying to do that was through the surveys to try and
right.
find the exact number. And since self-report, we don't have an accurate number of our state workforce that has been infected or that has died from COVID-19. Is that an accurate?
No, that's correct.
Okay. Thank you very much. Thank you, Mr. Chairman.
Delegate Proctor.
Thank you, Madam Chair. I'm looking at the unemployment program. I think your statement said that 30 million would go back to the general fund.
That's correct.
I've had several residents call and say that they have had their unemployment cards drained. And
So
unemployment officer telling us that there may be as many as 150,000 who have had this. And I'm guessing they don't know how much money that's going to cost them at this point to replace that.
So I zipped through this pretty quick, so I wasn't very clear about that. But that $30 million is for the state employee unemployment insurance fund. That is not for the state's unemployment insurance program for state residents. That is a fund that is only for the insurance of state employees who become unemployed.
Thank you.
Okay. Any other questions? Seeing none. Thank you, Mr. Kramer. Great job.
Thank you.
So next up, Secretary Brinkley and your team.
Good afternoon, Mr. Chairman. Can you hear me okay?
Yes.
Okay, excellent. So good afternoon, Mr. Chair, Madam Chair, and members of both committees. It's a pleasure to be here in front of you. This is certainly a unique format for all of us. For the record, my name is David Brinkley, the Secretary for the Department of Budget and Management. With me virtually today is Deputy Secretary Mark Nicole, although he's here in the conference room with me. But Glynis Watford, the state's People Employment Opportunity Coordinator, is also here virtually. The Executive Director of our Office of Personnel Services and Benefits, Cindy Kollner, is here virtually. And Christina Kaminsky, the Director of the Employee Benefits Division. I believe she's on here. I saw a person named Christina with no last name. I sent her a text, but honestly, I put a new filter on my phone and I can't read from the side. She's on board too. I appreciate the opportunity to respond to DLS's analysis of the proposed FY22 budget for DBM personnel. I'm here today, number one, to testify in support of the FY22 DBM personnel budget, to respond to the issues and recommendations raised by the analysts, and to answer any questions that you may have. And certainly if we don't have the answers here, we'll make sure that we get the submitted brief written testimony to you as well, which I will not read that to you. But I'd like to thank Jason for his thorough analysis for you and for the public, since they have access to those documents too. Most importantly, I'd like to speak to what our state workforce has faced over this past year. A year ago next week, Maryland had its first 3 cases of the coronavirus. No one could have ever predicted the challenges that we would face in the following months. The public health crisis that isolated Marylanders, or the economic crisis that left so many unemployed and others challenged in different ways. But at every turn, our state workforce has risen to the occasion. Our frontline workers have worked around the clock for the entirety of this year to provide the health to provide for the health and safety of Marylanders. We know we have the best state workforce in the country, and we remain committed to these hardworking, dedicated public servants. And I point out to you, we all are very aware of this, that their work continues. Much of our state workforce has transitioned to teleworking, which presents a whole new set of challenges and has uprooted the way the state government now conducts its business. The 2021 legislative session and this committee hearing are proof positive of that fact and transition. I'll turn now to the single issue highlighted by DLS with the proposed FY22 budget for DBM personnel telework. In response to the pandemic, state agencies have successfully transitioned much of their operations to remote work. The state's current telework policy is extremely flexible and designed to allow for maximum employee participation. As a result, DBM anticipates that the future of telework will remain or look similar to the current network model, but likely with some different performance metrics to ensure that teleworkers effectively perform their job duties. Generally, DBM believes that wide-scale telework will be a vital recruitment and retention tool for employees while resulting in a reduction potentially of leased office space. Any changes to the telework policy will require negotiations with the exclusive bargaining representatives. So on the DLS recommendations on the operating budget in general, DBM concurs with all the operating budget and budget reconciliation and financing act recommendations made by our GC. It's important to note that at the time, this is important, that at the time of our budget submission last month, the need for this reserve that he recommends the reduction to was very important because we did not know some key questions. We knew who and the where and the why the federal government was taking some of the action, but we did not know what we were going to get. We didn't know when we were going to get it, and we didn't know how it was going to be released to us. We didn't know how to access those resources. In other words, the strings attached or the limitations, if any, attached to them. We know that there are always plenty of strings attached. And to presume anything other than that would have been irresponsible. So since that time, we have received a continuation of enhanced FMAP, which certainly helps a lot. We went from 50% to 56.1%. That is an additional $300 million in funding for 6 additional months. We received more than $200 million in federal vaccination funding and a declaration that the FEMA public assistance funding will be 100% reimbursable with no state match. Previously, it was a 75-25 split. So therefore, DBM concurs with the recommendation to eliminate the $200 million reduction to the deficiency that we included in the submitted budget. However, we further note that there are still costs, such as the quarantine pay, which is about $35 million, various DPS-CS expenses, including inmate health care, that still need to be paid that, at least as of now, are not FEMA eligible. So this concludes the prepared remarks for today. I again appreciate the opportunity to address you and about the FY22 budget that we submitted to you. And like I said earlier, my team and I are prepared to attempt answer any questions that you might have. If we don't have any answers, we'll certainly follow up with you. Thank you, Mr. Chairman and Madam Chair.
Thank you. I think you're muted, Madam Chair.
Delegate Corman.
Thank you, Madam Chair. Thank you, Mr. Chair. Good afternoon, Mr. Secretary. First, you'll probably hear from a lot of people about concerns about disparate treatment of our state workforce. So I'll just pre-ditto them and then ask you my question, which is about electric vehicle purchases, which is discussed in the analysis on the bottom of page 12. And you all very kindly submitted a JCR in December of last year about your recent purchases. The governor has a goal of 60,000 zero-emission vehicles on Maryland roads by last year. We only made it to 25,000, yet last year DBM purchased, based on this JCR submission, 523 gas vehicles and a total of 6 electric vehicles. The analysis says it was only 5 fully electric vehicles, but I'll go with your 6 in the JCR since that sounds a little bit better. What can we do here to get us on the course consistent with the governor's own goal of increasing zero emission vehicles. I mean, if we're not even using the state dollars to do that, I'm not sure how we could expect anybody beyond our great chair, who I know has an electric vehicle, to make that investment themselves. So what are your thoughts on the use of the state dollars for the state fleet on zero emission vehicles, consistent with the governor's goal, Mr. Secretary?
Yeah, our big impediment, and the treasurer and I talk about this quite a bit because she brings it up at BPW all the time. And I can tell you that this office now has electric vehicles that we're driving. And what I find is the impediment is where can you connect it to get it energized? And I know that DGS is charged supposedly very aggressively with trying to put our infrastructure up in place. We're about to have some work done here at the DVM office building, so there'll be hopefully some charging facilities put up here, and then I'm requesting that. And that right now, I mean, honestly, Delegate, that's our big impediment. There aren't as many in the market. We now hear Volkswagen and some of the other manufacturers are bringing them on board, and Ford has even made a similar type of commitment. But right now, the options on the fleet that you can purchase from is somewhat limited. It's not entirely so. But you know, it's the charging facilities, it's that infrastructure, and I think now that's been a big push that we have moving forward. The other issue that we've run into is I know some state vehicles aren't getting turned over as rapidly as I'd like to thank, who's not here, but the chairman of the EU committee, his bill. We haven't seen them yet, but to incorporate some of that. And we're still trying to buy vehicles that don't have electric pickup trucks, for instance, at DNR or something like that. Police vehicles and those sorts of things are still, there's really not a big push on. But we did send out a directive that if they're purchasing vehicles, they have to tell us why an electric vehicle won't suffice. So for instance, the one that I have, agency bought it, didn't like it, and we took DVM bought it from that agency. I don't know what agency it was off the top. Yes.
Mr. Secretary, can I jump in real quick? I don't know if other people are experiencing this, but as I think you turn your head, we're missing words.
Okay.
So if you can sort of focus right in on whatever mic you have, it would
I don't
be.
even know where the microphone is. I'm clearing some papers off the laptop. Maybe the microphone is over on that side. So I apologize for that.
That's okay. You're better now.
Okay. I don't know if the mic is up here or if it's over on this corner, but
Something's going on.
Mr. Secretary, just to be clear, just because I can tell the chairman is getting restless. The other chairman, Madam Chair.
They tend to do that sometimes.
The process now is if an electric vehicle will not suffice, the agency has to explain why. That the default is for them to go a fully electric zero emission, or at least a zero emission vehicle. Is that an accurate statement?
I think that directive went out this past summer.
Okay. Could I get a copy of that whenever you have it, whenever your team has an opportunity?
Yeah, we'll send you a copy of that.
Terrific. I appreciate it. Thank you, Mr. Secretary. Thank you.
Sure.
Yeah, and I want to thank Delegate Corman for that question. As someone who has now I'm in my 7th year driving an electric vehicle. And by the way, I will commend the Speaker's office. They got us plenty of charging stations as we grew in number in the House of Delegates. So that's something you ought to look into. We have a couple more House members that have questions. Let's go to Delegate Solomon.
Thank you, Madam Chair. Mr. Secretary, it's good to see you again. I had a question specifically around some of the vacancy rates that are in the appendices here. And I guess in particular, just curious about the Department of Labor. We know obviously all the issues with unemployment, with the Occupational Safety Office as well, not really being able to do inspections. Obviously there was an all hands on deck approach with the Department of Corrections, and it's good to see that number come down, but some of the other agencies, particularly labor, we haven't had our labor hearing yet, but would just be curious, is DBM working constructively with some of these agencies that have really high vacancy rates, particularly labor, to try to bring those down, especially in the areas that we really need to see, more staff?
Yeah, we are working well. We did, one of the cost cutting measures we had was to impose a hiring freeze. The government imposed a hiring freeze early on. But then we've also been, as agencies reach out to me on a basis to say, look, I really got to have this fixed, or I've had some attrition, or I've had some other overriding issue, you know, we need some waivers, we need some assistance. And we're working very closely along those lines. Recollection is you know, labor has been entirely focused more than all hands on deck, because I even sent some of my CCU personnel when Central Collections was not able to do any collections, because again, once the pandemic hit and shut all that down, we reallocated some of our force to try to help them out with the unemployment barrage that's coming through. I know that they've been very focused on dealing, number one, with the claims that they've had, but then also backlogs and dealing with a lot of those issues there. But we'll get to you specifically on some of those other issues in the back of the room on because I don't know that we've had any requests necessarily. They might have come in upstairs, but I'll find out that we have to move forward on some of those. But it's been a case-by-case basis along those lines, but right now, all the resources for labor, I'm focused on trying to make sure it's coming.
Secretary Brinkley,
Just a second, Mark has
I would note that when we did implement that hiring freeze, that we did exclude all staff of unemployment insurance. So we knew that that was going to be a key priority area. So that is not part of.
Did you hear that answer? Because I know he's messed up. What he said is when we did the hiring freeze, for those that didn't hear it, we specifically excluded Department of Labor for their unemployment insurance program and everything that was around that area. So, and I know she was very aggressive in trying to make sure she had the work that she needed.
I appreciate that and would appreciate additional information on the vacancies. I mean, I guess that if we're not talking about the UI program, then that 14.2% distributed in the other areas is equally concerning. So that'd be great if you could follow up. Thank you. Thank you.
Thank you.
Delegate Krim.
Thank you, Madam Chair. Ms. Secretary, good to see you, of course. And I do want to thank you and your department for helping us work through the telework bill. And I do want to follow up on the previous questions of Delegate Solomon. I know that there was a pretty extensive staffing study done in 2018 by DLS. I'm wondering if we're using that to make progress in the area of these vacancies in the department, if we're like using that as a baseline, perhaps. So thank you.
You see, Cindy, if you've activated your microphone, and maybe you have a direct response to that, I'm calling out into the universe. Cindy Coleman.
Yep. So the staffing study that was done several years ago by DLS, is that was your question, whether we're using it?
It was 2018.
Right. My recollection is I'm not sure that we specifically agreed with a lot of the recommendations or the conclusions made by DLS at that time. So I don't believe that we're using it as a baseline. What we're using is basically the input coming in from the agencies about their staffing needs today. Even though at that time, I don't think we agreed. I think today's needs, given the pandemic and everything has changed. So I think we're responding to what the needs are today and the priorities that we're having to deal with now. And I think that's reflected through the hiring freeze process. We have certain classifications that are excluded from the freeze. Any position that was entitled to the response pay initially, those positions where people have to come in and do the work, as well as the labor positions, they are all blanketly excluded from the hiring freeze. And then to fill positions elsewhere, the agencies have to submit the justification to the department. So I think I answered your question, maybe. If not, let me know.
Well, only that if you could provide me with what you disagreed with the staffing study, I would appreciate that. The recommendations, okay? Thank you.
Yes, I think we disagreed with sort of the conclusion that the agencies were severely understaffed at that time. All the conclusions, I think, from the study. We'll get you with what we disagreed about.
Mr. Chairman, you'll like this. That,
Yeah.
my team says they're ordering a new microphone for me to use, I guess, for these hearings. Be a little more responsive along those lines.
Delegate Haynes?
Thank you, Madam Chair. Secretary, good to see you again. One quick question. I just wanted to be a little bit more specific on vacancies. I know for instance, if you look at the Department of Corrections, I think about 500 pens were eliminated from that particular department. Part of the justification has been because our facilities, our jails are smaller now, the population is smaller. There's a variety of reasons behind that, but I think what has happened is that with that population, inmate population decreasing, it has also maybe perhaps increased formerly incarcerated individuals into the community where they now are under the umbrella jurisdiction of parole and probation. But those numbers have not increased. So my question is, even though we reduced 500, would it be reasonable to assume that there would be a need to increase the positions or pens in P&P to accommodate the increased load there? Is that something that the DBM has considered at all, or request from DPSCS?
Good question, Delegate. Our goal on the reduction of the 500 pins is they were vacant, and based on what it took to do the training to hire people in the department, he still has sufficient vacant capacity to do training and to do recruitment and everything else. Where are we still 1,000? Yeah, there still are 1,000 vacant positions at DPCS even after that reduction. So what you're saying is very valid. The other good thing about what's recently happened with that particular agency is some of his ideas have stopped the hemorrhage. That's not to say we still don't have challenges there. So the reduction in populations helps, but there's still some other challenges that we have to face. And his actions in his recruitment bonuses, his retention bonuses have been very key to stop the hemorrhaging, to the point that his numbers are no longer in the red. They've come back into the positive category so far as changing the slope of that curve. Now, when the retention bonuses wear out, when 4 or 5 years is up, who knows what we're going to see at that point in time. But for now, we're going to slow that curve. So he still has the capacity to do the hiring and be very aggressive along those lines. And frankly, in my conversations with the governor, I even said, I kind of am looking forward to the day when he says, look, I need more things. I've got these things filled. So I think what you bring up is very valuable and very important, but he has the capacity to still go ahead and make those accommodations. But from a budgetary point of view, it certainly allows us, and if I'm not mistaken, we move those monies into the overtime category, because that's where it was being moved to anyway. But we still, this way, we can do some more truth in budgeting to say what really are our numbers on the overtime aspect of that particular agency.
Okay.
But you're right along your underlying premise with parole and probation and supervisory capacity there.
Okay, thank you very much, Secretary. Thank you, Madam Chair. Okay, I do not see any more questions for the Secretary, his team right now. I'm going to move on. Madam Chair, the first name on my list is a little unusual. Is this accurate? The Delegate Penny Melnick wanted to testify?
This is Michelle in Appropriations. No, she's not meant to testify.
Oh, okay, very good. All right, then we'll go on. It looks like we have at least 4 or 5 people from ASME. The first being Monica Mayo.
Good afternoon, and thank you for your time today. My name is Monica Mayo, and I currently work for the Baltimore City Department of Social Services. Case managers have been experiencing an increase in stress that has only been magnified by the pandemic. Insufficient staffing and poor financial compensation are just two of the contributing factors. The lack of staffing has contributed to the stress and has become a detriment to the quality of the work being completed. There are currently 287 positions that can be filled immediately. We are requesting that those positions be considered a priority. Furthermore, the lack of fair living wage has negatively impacted the quality and quantity of those applying for those positions. The lack of fair financial compensation for the work that has been done has been one of the topics of most concern with my colleagues. I have a friend who works for the same Department of Social Services who had to make the difficult decision of paying her bills and making sure that her college-age student was able to continue her education, and to her detriment lost her hearing because paying bills and making sure your college students should come first. And because she was not able to adequately go to her doctor's appointments, she lost hearing in one ear because of an infection in her tooth. Please note she is a diabetic and also has asthma, is on to different types of medication for that as well. This is the human cost that we see every day with our colleagues. In closing, my colleagues and I consistently report to work on a daily basis. We put forth our very best effort, and we are dealing with an unprecedented, life-changing pandemic that has impacted each and every one of our families beyond imagine. We do this all while dealing with a lack of sufficient staffing and not being financially compensated equitably for at least more than 8 years now. And these are just a few of the adverse impacts that have taken place to the workers, as well as the millions and millions of Marylanders that we serve on a daily basis. Thank you for your time today. Good evening.
Thank you very much. And I'm going to apologize right up front on this next name. I see on the screen that you're listed as Olanyan. You can help me out with your pronunciation.
Thank you, sir. Good afternoon, distinguished chairman and all other members of this committee. I am Sergeant Olaniyan Oluwadamlola, and I am the president of Local 1678 and a JSOP correctional sergeant. We are here today because we have hope in this committee and the process. This body gave us hope and encouraged our members by giving us 5% last year. Short staffing is an epidemic in the state agencies, and most especially my agency, DPSCS. I applaud the aggressive drive of Secretary Green in recruiting new officers, but unfortunately, the problem is bigger than that. I remember the recruitment of the Puerto Ricans 2 years ago, and I wonder if they are still on the department's payroll. When the pay is right, when the step increases and COLA are not being withheld by the governor, when we are being respected for doing what many people don't want to do, then you will have a good retention rate and stable recruit that will stay on the job. Over 65% of my members in JSOP region alone volunteered to work 160 hours every pay period to avoid being drafted or mandated to work against their will. Many like me across DPSCS rarely see our families just because we need to volunteer to avoid being mandated to work. I am neither ashamed nor proud to say that I hardly see my 3 handsome boys during the week that I have to volunteer. Truly, short staffing affects our families. State employees deserve to be treated with respect in the areas of health and safety issues. Also pay us our step increases that are long overdue and stop the disparities, divisiveness, and pay us what we deserve. As a correctional officer, I protect the public, the inmates, and other non-uniform staffs every day. I am here today with my colleagues from other agencies because We want this body to come to our rescue and fight for us like never before to make sure we get what we deserve. Thank you very much.
Thank you. Sean Santmeyer?
Santmeyer, sir.
Santmeyer, okay.
Sean Santmeyer. Good to meet you, sir. Greetings, my name is Sean Santmeyer, and I'm here to testify on behalf of AFSCME-MD. Our local represents the workers who make Department of Labor happen every day. We as a union want to express our support for House Bill 1002. Again, I want to say that we want to express our support for House Bill 1002. While our members have worked hard and performed to high standards, continued training and support is needed on a system that has been riddled with glitches and problems. We are also supportive of ensuring the adequate amount of staff this bill will bring. But we want to ensure that they are hired for positions that are on the front lines. We see no need for any monies to be used for positions that will be supervisors or managers. At my last glance, the Department of Labor had one supervisor for every 4 workers. One point we need to make clear, though, about this bill is that our brothers and sisters work on cases that can be complex. Direct lines to the worker's desk that the public had access to would lead to a large amount of unproductive time. Thank you for your time, folks.
Thank you, sir. Appreciate you taking the time. Ashley Watson?
Thank you. Members of the Personnel Committee, my name is Ashley Watson, and I'm a case management specialist at the Department of Juvenile Service Cheltenham Youth Facility, and a proud member of AFSCME Local 3167. I thank you for the opportunity to come before the committee to speak on the Department of Budget and Management hearing this afternoon to highlight a couple of my concerns. My first concern is understaffing. As a state employee working in one of Maryland's state agencies, I continue to work more with less. When there are not enough resources allotted to public services, workers like me, we suffer and our clients suffer. This also means that people are stretched thin, trying to do work to make up for many vacancies. The issue of understaffing continues to be a concern of mine and many other state employees. This issue was heightened even more during the pandemic as we continue to keep me and my coworkers safe as we continue to provide the necessary services for our youth. As a caseworker, I know that understaffing hinders DJS's mission to help juvenile offenders overcome their behaviors and become productive adults. Pay raises is another issue I want to address for state employees. While we have so many have been affected by the pandemic, I myself was directly affected by the tragic death of my husband. This now leaves me a single mother to raise my children. While preparing for my kids' future, it now makes it extremely hard to afford the basic needs of life, as well as save for long-term goals such as college for them. I've worked for the state for 12 years, and my pay has been very stagnant. Inflation and daily costs seem to increase, but not the pay for me and my AFSCME brothers and sisters. In the governor's budget, he did not include a pay raise for DJS workers and other AFSCME members. We did notice that he included a guaranteed 5% for police. Do DJS caseworkers and other hardworking state employees who are trying to provide for their families and making sacrifices during a pandemic not matter to public safety? We at AFSCME believe we matter and we deserve a raise. It's only fair. State employees lack pay compared to other states and national trends, and we no longer want to have to choose between family and work because we simply aren't being compensated enough. I urge this legislation to please help us secure a raise in the upcoming budget. I want to thank the committee for your time and giving me the opportunity to raise these issues, not just for me, but for my fellow state employees working on the front lines, keeping Maryland running during the pandemic. Thank you.
Thank you, Ms. Watson. I know I speak probably for all of us here. I'm so sorry about your loss, and thank you so much for taking the time with all that you've got going on to share your concerns. We appreciate it.
Thanks.
Lance Kilpatrick.
Thank you, Mr. Chair, Madam Chair. Good afternoon, members of the Senate Budget and Taxation and House Appropriations Committees. For the record, my name is Lance Kilpatrick, and I'm the Legislative and Political Director for AFSCME Council 3. We thank you for the opportunity to address the committees today to discuss Maryland state personnel. What a difference a year makes, right? As Secretary Brinkley said, we've never dealt with a challenge like COVID-19 before. Frontline employees across Maryland have fearlessly continued reporting to work, even through shortages of PPE and information. And I wholeheartedly agree with the Secretary that they've responded to the challenge. Because of the work of frontline employees, we have limited community transmission out of our public congregate care facilities. But this has been done while having to surmount seemingly endless obstacles put before us. A lack of PPE, including an ongoing fight over getting N95 masks, a lack of planning and safety protocols that have led to wildly divergent responses to outbreaks from facility to facility and campus to campus. To this day, AFSCME has been unable to bring the University System of Maryland to the table to negotiate health and safety protocols for a virus that cares not whether you're a terrapin or a terrier. In every state agency, AFSCME has been demanding, begging, pleading for directives and protocols to ensure the health and safety of our work sites. The response has been underwhelming. What we need are health and safety mandates that are statewide and enforceable. But Maryland's chronic understaffing of its facilities have made a bad situation worse. Statewide, the vacancy rate is at 10.7%, but this doesn't take into account the hundreds and hundreds of PINs that have been eliminated over the years. When you take into account PIN elimination and still have vacancies rates of 10% and more, it makes the underlying story even worse. For example, the Department of Health has a 10.2% vacancy rate, but this doesn't account for the fact that staffing levels at county health departments have never returned to pre-Great Recession levels, which has hindered the ability to fight the pandemic and deliver vaccines. The Department of Labor has a 14.3% vacancy rate, while unemployment insurance claims are still significantly backlogged and health and safety inspections sparse. The Department of Human Services has a 10.2% vacancy rate, which doesn't take into account the 127 PINs that were eliminated in this budget. Understaffing has hampered the delivery of SNAP benefits during the pandemic. And DPSCS remains the vacancy leader at 15.8%, despite a reduction of 500 PINs in the 2021 fiscal year, as Delegate Haynes pointed out. So while the vacancy rate at corrections has been somewhat reduced in part due to aggressive salary increases, please keep that in mind, and inmate population reduction, parole and probation staff have had to absorb an ever-increasing caseload with greater complexity. As you can imagine, COVID-19 has exacerbated the existing understaffing consequences. There are real safety concerns with so much overtime being mandated at our 24/7 facilities, where we see so many of our members required to do consistent 16-hour shifts. And frankly, I'm guessing they would disagree with Ms. Kolner's assessment on the level of staffing. All of this has come with a horrible cost. Thousands of state employees have contracted the virus while continuing to serve Marylanders, particularly those in crisis. And to date, we're aware of 10 deaths in the Division of Corrections, the Department of Health, the Department of Transportation, and within the campuses of the university system. How has the administration responded to the staffing crisis? Well, changes in fiscal years 2021 to 22 show 486 fewer authorized positions in staffing and executive branch agencies, but an increase in 198 contractual positions. This is symptomatic of an ongoing trend with the Hogan administration. From fiscal years 2015 to 22, authorized positions fell by 2,500, roughly 5%, but contractual positions increased by 860, or 36.3%. In fact, while Maryland's population over the past 10 years has increased 4.4%, the number of executive branch positions has decreased 5.2%. We are one of the wealthiest states in the nation, yet we rank in the bottom 40th percentile for number of state employees per capita and average state employee salary. Since 2002, AFSCME representative members have seen their salaries fall 20% behind the rate of inflation. How has this happened? Well, first, this is a bifurcated system where administration favored state employees receive steps and larger COLAs than others. Second is the effective demise of steps for the vast majority of state employees. A step is supposed to be an annual salary adjustment in the recognition of a satisfactory evaluation and an acknowledgement of acquired expertise and value to the state. Yet, despite legislation enacted a few years ago calling for mandatory steps, ASME represented members have seen only 3 step increases in the last 10 years. Let me close by saying we appreciate all that the committees do for us, but to all involved here, let us be clear that the lack of investment in our personnel by the state has left a hollowed out workforce that constantly strains to the point of breaking. Thank you, and I'm happy to take any questions you may have.
Thank you very much. Any questions for any of the witnesses? Madam Chair, I don't see any questions. I think this is the conclusion of our hearing.
I believe it is too. I do want to, if I may, say that I agree with the last speaker. And we got from DLS, I think 3 to 4 years ago now, I think it's 3 years ago, a report that was very worrisome that said some of our agencies, because of vacancies, were having a hard time fulfilling their mission. And Mr. Chairman, you and I have talked about the challenges now that these agencies are facing with COVID. Some of them, the very agencies we need the most. And so I do think this is an area, again, we're going to have to go back to the administration and make sure that we get more hires, better pay, make sure they get paid for overtime that they've put in, because the state workers were our front line in this COVID year and continue to be. So I thank you for, Mr. Chairman, letting me share my views on this. Thank you.
No, of course, as usual, well said. This is going to conclude our hearing. For members of Budget and Tax, we are going to not be able to do the earlier of the 2 voting sessions we were going to have today. So those of you who have capital budget, just please proceed to capital budget. And then after capital budget, we will do the second voting session that we were going to have, which should probably be in the 4 to 4:30 range. So thank you all very much.
Thank you.
All right. Have a good afternoon.